Welcome everyone to the May 27th NEMSIS V3 implementation call. We are happy to have you this morning. We've got a pretty full agenda, so we'll move along pretty quickly. Please feel free to unmute your microphones to ask questions or comment. Also use the chat feature in Zoom if you have questions or comments. We have team members watching the chat feature as well. So if you're not able to vocalize your questions or comments, we'll make sure we ask them for you off of the chat feature. Again, if there's anybody on the phone that wants to give a shout out as to your name or your agency, we're happy to take those down for you. We know that there are many people that are able to only join through phone, so we're happy to track that for you if you'll give a shout out. Great. Bridget's going to start us off this morning with just a quick review on our participation tracking.
Good morning, everybody. Thanks so much for joining us. I just want to kind of go over really quick to make sure that we get everybody listed on our logins when you guys come in. We want to make sure that you guys get the credit that you guys deserve for taking the time out of your day to be able to get those points and make sure that you guys are staying compliant. So when you're logging in, just make sure that when you have that option to go in and put your name, make sure you do that. Along with that, if you can put your state or your vendor name, that helps us so much. There's no way for me to know, because I'm the one that actually tracks all of this. There's no way for me to know who's calling in off of a phone number unless you actually either email me, send me something in the chat, or let us know at the beginning of the call. We just want to make sure that if you're here, we want you guys to make sure that you get that credit that you guys get. I have people that are logged in under just your vendor name. I don't know who that is. So if you guys can either shoot me an email, and I'll put my email in the chat feature so everybody can have that, or you can just do it to the NEMSIS website or off of the website, and we can take it that way. Other than that, it's been amazing that we've gotten a couple people that we were able to fix, and thank you so much for being so honest and letting us know those phone numbers that you guys are calling in on. That way we have that, and then we can track it that way also.
Any questions on vendor tracking? Excellent. All right, Clay, it is all yours.
All right, thank you. It's a pleasure to be here with everyone. I'm going to ask if I can share my screen. Is that possible to do? Great. Okay. Fantastic. Wanted to spend a little bit of time giving folks an update in regards to the collaboration between NEMSIS and the ET3 project. Folks probably know that that project has been postponed a little bit due to the COVID epidemic. They have just postponed it to the fall of 2020. Just showing you a quick model of a summer timeline that their developers are hoping to be able to follow. So folks probably know that just over 270 EMS agencies across the country have been chosen to participate in ET3. The CMMI group that is running ET3 from CMS is working hard now to identify those participants, collect the background information necessary to get them set up to be able to participate in ET3. And so that's going on right now. We have weekly meetings with them in regard to developing the model, whereby the ability to determine the success of ET3, either treatment in place or alternate destinations for transport, that can be evaluated using NEMSIS data. So they'd very much like to be able to implement a process of data exchange that just utilizes our model as closely as possible. That will certainly help the vendors in implementation for those agencies who are participating use their software. So we had a meeting 2 weeks ago with the larger NEMSIS data strategy group. So there's a number of vendors and others who participate on this call who also participate on those ET3 model calls. Purpose of having those vendors on that call is just to ensure that we're aligning with best practices that they're using to implement NEMSIS to try to reduce their development time to have agencies participate in ET3. If you'd like to track with that larger group and have a closer affiliation with this development, please just let me know. So, so you see their plan truly is to have their CMS enclave built out to be able to receive NEMSIS data by August, with the idea that then there would be a 3-month period where the vendors would be able to implement their process. We're hoping to communicate well with you folks as they're moving forward in the early summer months, and so that by the time those tools are developed, you'll be well aware of what they look like and what they do. If so, I'll scoot over here just a couple of quick versions of some documents that are available. This one's available on the CMMI website. This just lists all of the agencies and the states that they serve that have been chosen to participate in ET3. So this might be a valuable list for you to go through, just to take a look at what clients you have that are participating in ET3. Also, just going to show you real quickly a very dated kind of schematic of how they expect to receive data. And I apologize, this has been updated, so some of this information is not correct. But basically, what they're planning to do is they'd like to receive data directly from the agencies. As agencies are submitting data to their states, you know, regardless of where that server sits that receives that data, if it sits within an enclave maintained by a software company, or whether a state actually has the records go there, they'd like to receive that same level of data coming directly from agencies into the CMS enclave. So you can see here, they're basically looking for the agencies to be able to send the data directly. They are planning to implement a schematron that's associated with ET3. I think it'll be a fairly simple one at this point. The idea being that the vendors would be able to implement the national schematron file and the ET3 schematron file for the data that's going to the CMS enclave. There'd be no need to run the state schematron file, because though that's the same data that goes to the state, this one would be coming to the CMS enclave, and we could then be sure that there's no conflicts between the ET3 schematron file and maybe a state schematron files. So that's the idea, that it would flow directly across and then into the CMS enclave. They'd like to receive the data as you're sending it, the quote real time rather than batched, but there will be other mechanisms available to send in data. Those are being worked out. And then they're requesting that the NEMSIS tag here provide the demographic files associated with the participating agencies with their permission through their contract with ET3, that they'd get the DEM files that we have received, just so they have some background information on those agencies. So I'll pause there for just a moment. We've covered a lot of information about what's going on with the ET3 project. Are there any questions regarding participants or the current work to ensure consistency with the NEMSIS data flow, or any other questions? Okay, if you have any other questions, feel free to bring them up during the call. Thank you, Julianne.
Hey, Clay, can you share the updated version of that last slide out to us, to the group?
Yeah, happy to do that. And I apologize. I have it on my work server and I can't seem to be able to connect to it. So yeah, I'll send that out. Thank you.
Any other questions for Clay on the ET3? Okay. Next on the agenda is the ILI Dashboard. Kevin, do you want to address that real quick?
Yeah, very quickly. I'm going to go ahead and share my screen just really fast. So first of all, just once again, I want to thank everyone for sharing and providing feedback on the ILI dashboard. We continue to see an increase in the utilization of the dashboard, which is fantastic. I think, as Clay mentioned last week, some of the feedback we received, particularly from Dr. Lerfeld in Oregon and Josh Legler, has prompted us to make a change to our scoring criteria. We are now checking provider impressions as well as symptoms to determine if an activation satisfies the documented ILI criteria that you can find in our user guide. This change to the criteria has increased the rate at the national level and at the county level. In response, we have adjusted our color coding scheme for counties. Now, while this change has increased the national and county rates, it has actually not altered the shape of the curve in any appreciable way, which is still trending downward. If you'd like to know more about this recent change or would like to access the ILI dashboard, please contact me or anyone else from the NEMSIS TAC. And I'll pause there and see if we have any questions in relationship to that.
Hey, Kevin, do you recall how much impact that had on the number of records that it selected? Was it like a doubling or a 10% increase? Or?
So overall, at the national level, it actually came close to tripling the number of activations that we scored as meeting the criteria.
Thanks.
Mm-hmm. All right. Anything else? All right. Back over to you, Julianne.
All right. Thank you, Kevin. Next item on the agenda is just to show you where the updated timeline is. We talked about this on the last V3 call, and I've also discussed it with the NEMSIS data managers. So we just wanted to show you where the updated timeline is available to you off of the NEMSIS website. So starting just on our front page.
Julianne.
Yes.
I'm showing a different screen.
Oh, all right. Well, let's share the right screen. How about that? Does that look like, are you seeing the website now?
Yes.
Okay, and not my email and chat?
Uh-huh.
It's a good catch. Thank you very much, Atim. All right, so now that we are actually on the NEMSIS website, right here we've got the V350 release timeline. And on this page, you'll just see all we did was update the sunset date for the 334 to August 21st or August of 2021 to match the anticipated broad market availability of software for 350. So this timeline's been updated, and the associated timelines below it have also been updated to reflect that extension in the sunset to 334 right there as well. If you need any of these visualizations, there is a PDF down here that includes those three, so you're welcome to use those as needed. and that is just on the main NEMSIS website. Any questions on the timeline for the versioning schedule? All right. Next on the agenda, Clay is going to talk for a little bit about resolutions, DMC resolutions.
Julianne, there's just been one quick question on the timeline. Elizabeth from Zoll would like to know, is 334 been extended as well?
Thank you for that, for catching that, Kevin. So Elizabeth, the sunset date for 334 was extended 6 months to match the broad market availability of 3.5. So if you see here just on this, on the timeline, instead of 334 sunsetting and being closed in February, it will now be extended to August of 2021. So 334 data will continue to be received at the NEMSIS TAC until August of next year. All right, any other questions on that? Great. Clay, do you want the screen for the next item, or should I just put up the agenda again?
Yeah, please, thank you. If you
Okay.
would, that would be great. All right, fantastic. We're moving right along. So the next item here, we're attempting to get caught up with a spring that was derailed, and getting back on track with our deliverables that we have for the Office of EMS at NHTSA. One of those deliverables this year was to work with NEMSIS to see if we could pass 2 resolutions, that is, gaining consensus from the data managers within states and also the EMS directors for 2 changes to the processes of NEMSIS. And I have those 2 resolutions that were drafted in early February here. I'm just going to show them to you. We'd like to discuss them on the next call in greater length because they do have some technical implications. This first one really does not, but it's perhaps important to recognize both of these that we hope to pass on to the DMC and have them pass and then on to NEMSIS in some form this summer. Of course, neither group is meeting in person, but we're hoping that there'll be a process in place whereby these resolutions could be voted on. So this first resolution is basically a reworking of an earlier resolution that was passed. The Office of EMS at NHTSA would like to formally develop a process whereby state and county identifiers could be released to researchers strictly for public health surveillance, so syndromic surveillance. So this resolution would allow the NEMSIS TAC to release to researchers those 2 geographic identifiers only with information related to syndromic surveillance. So no EMS performance measures, elapsed times, or anything like that would be released to researchers, but it would allow us finally to be able to share data like the CDC often shares, and I think this has been accentuated with the work that's happened related to coronavirus. The other resolution that probably has more implication and impact to this group is the idea of taking the suggested lists for many of the elements that are found in NEMSIS and making those defined lists. So the idea here is we need to provide some level of consistency in how our providers are answering questions related to symptoms, impressions, medications, procedures. There are just great inconsistencies and much error present in the data just based on, for a number of reasons. And we can cover that when we go into this in more detail. But the resolution is to try to standardize the lists associated with those elements, to provide more consistency at the state level, and also at the national level. Some questions related to this that are being worked out that we'd like to discuss on the next call is, for example, how would this list be updated? Probably the idea is to update it annually. If there's some additional codes that needed to be added, for example, the COVID-19 codes, for example, this year that will be converted from U codes into actual codes in the B section. That is a great example. The other question is, the idea here is, and feel free to read through this, is that these lists would be associated with the primary type of call that NEMSIS was built for, that is 911 responses to a field response for pre-hospital care. So things like specialty care, critical care, interfacility transports, they clearly just explode the number of medications and procedures that need to be listed. The idea here would be that those would be custom lists that perhaps states might develop, or we would love to have a custom list that could be added to this element related to those specialty cares and maintain it here if that would be valuable. But the idea is that these defined lists would cover a 911 ground response EMS activation. So that's just a high-level discussion of these two resolutions. Are there any questions about these ideas?
Hi, Clay. This is Samantha with ESO. I just wanted to verify that we're going to be spending more time in depth talking about how this would look. Especially, I'm real concerned about medications and procedures being defined and not being able to add to support our agencies.
Yeah, Samantha, that's a really good question, and we'll spend much time on this on the next call, and if it needs to roll into the call after that, we're happy to do that. We'll prepare a presentation that just lines up the questions, and then let's work through this in a way that will help us to be able to standardize these lists in some ways that are helpful for the
All right, thanks.
states. Yeah, thank you, Samantha.
Hey, Clay.
Thanks, Clay.
Sorry, Keenan.
Go ahead, Felicia, you're good.
I have a question about the other draft, the one with the county and state stuff. Are you guys going to do any kind of suppression rules for small numbers?
Yeah. So that's another great question that we'll bring up on this discussion, is a small number question. That's an important one, Felicia. Thank you.
Thanks.
Yeah, Keenan?
Clay, back to the defined list resolution. I just want to establish where we are in the timeline. Are we past the point of sort of arguing the merits on if this is the right approach or not?
Great question, Keenan. I don't think we're past how this would be implemented, if that's your question. I think the idea that we need to somehow reduce the variability in those lists is an edict that's been passed into us by the Office of EMS. So that much is for sure. We talked about some other mechanisms in the annual meeting that we held in Deer Valley 2 years ago, and there were some other ideas that were brought up, Keenan. For example, hard coding in these lists and other options like that. We settled on this approach, and we'll review that next week. But if there's some other methods of implementing this, then we'd be open to that, Keenan.
Okay, similar to Samantha, I have concerns, mostly just in general, that we have made something that's already complex even more complex by trying to figure out a complex solution to simplify something. And that may not be wholly applicable to all of our customers and all of the providers across the country. We can talk about it.
Thanks, Keenan. Yeah, super. Appreciate your concerns and clearly want to hear them. when folks attempt to use their data, there's clearly complexity in the thousands of codes that exist now. So yeah, we do need to simplify this process, clearly not make it more complex on the implement.
Yeah, and we had some good discussion about the possibility of rolling up codes and grouping codes that I think we should sort of bring back to the table.
Okay, great.
Yeah, definitely. This is, looking at this narrowly, it seems like it might simplify things, but actually it's going to make it much more complex because now you have 3.3 and 3.4 data out there which didn't have these restrictions, and now they're creating incompatibilities. You're making a break in the data set, which anytime that's happened before, we got a lot of pushback. Like, definitely we need our historical data to come forward.
Fantastic, David. We'll talk about that. I know that states are implementing roll-ups just to try to deal with this in some way. So, yeah, you're right. It'll be a change. Let's talk about how we can best implement it in a way that would be.
So, where do we want to simplify this? Is this the view of NESMSO into NEMSIS?
We would like to simplify the list for the providers is the number one kind of requirement on this. It was passed down from the Office of EMS. And then in an attempt to ensure that data can be shared across states and nationally, we also want to simplify the codes that end up coming into state repositories and the national repository. So we clearly see codes coming in just based on code exhaustion from the providers, where there is just a list of so many codes that they end up coding every injury code as a symptom of pain and just leaving it there. So simplification of what's provided to our providers. And then for us, we have 20 different codes for pain. And so it would be great if there was a standardized code that applied across the nation. Those are high level, but that's kind of the idea, David.
Okay. Yeah, I'm definitely not wanting to. We have the exports built for taking those complex codes and turning them into on the hospital side, that they can handle those complex codes, and I don't want to kneecap them.
Oh, got it. Okay, I understand what you're saying. Okay.
Same thing with billing imports or exports rather, and integrated billing systems. I'm not here to beat the dead horse this Wednesday, maybe a different Wednesday.
Mm-hmm.
Yeah.
Great. Yeah, those are great comments.
Hey, Clay.
Yes.
Oh, hey,
Tim.
this is Tim in New Jersey. How are you? Just to kind of on the other end to support it, probably from the state perspective, one of the biggest complaints that we get is the numerous amount of codes, and as we said before, with the agencies and what we're finding, and we had this in other discussions with the other committees, is we're finding that agencies, especially just on the mainstream 911 calls, are finding that shortest, like you said, the shortest distance, and they'll pick one code and they just stick with the one code because they don't want to go through the exhausting list, which at the end of the day is going to give you garbage data. So I can understand the need to have the choices and have all the different elements and codes in there for billing and for everything else. But at the end of the day, if the crews are literally just picking one and just sticking with it just because it's the easiest route, it's not doing anybody any good. So I think that the need to reduce it down there is urgent at best.
Thank you, Tim. All right, any other comments regarding either of these two resolutions? Again, we'll dig into both in greater detail starting on the next call in 2 weeks. But any other comments that perhaps could set us up here at the attack to ensure that we're providing information that would be helpful for that discussion? Okay, great. Great. Thank you for the comments. It was incredibly helpful. We'll come prepared with these comments in mind and some historical information and some pass forward, and we'll have some great discussion on the next call. Thank you, Julianne. Turn it back over to you.
Any other questions for Clay? Next on the agenda are potential topics for the next annual implementation meeting. Clay, do you want to lead that discussion?
Sure. Happy to do it. Yeah, thank you. I didn't realize I was up next, or I would have kept the floor. So as folks know, we are changing the venue of our annual meeting from a face-to-face meeting in Deer Valley, which we will sorely miss having the opportunity to spend time with you, to developing an online Zoom meeting, probably a 4-hour to 5-hour meeting. We talked about this last call, and there was a strong interest in ensuring that the data managers and the vendors could be in the same Zoom meeting. So that'll happen. We're beginning to put together the agenda now for that meeting. We have some folks who want to present at that meeting. The CMMI ET3 project want to have some time during that meeting. Of course, we'll probably hold this meeting in the August-September timeframe. We'll nail down the date and time for this meeting in the near future and pass that on to you. They feel like they'll be well into the development of their process for data exchange and data acceptance at CMS. So they would like to be able to present during that meeting just to finalize that process and bring everybody up to date as to what's going on there. So that'll be included. We'll also have a section that will try to get us back on track in regards to patient data exchange. So we had great plans in the early spring to be able to develop both some new products related to 3.5 for the exchange of data from, let's say, an ambulance into an emergency department. So that flow of the EPCR data into the hospital, and then also patient data exchange on the back end, where e-outcomes data, other outcomes data could flow back in to the EMS agency and populate the e-outcomes section and travel to the state and the national level. And we have to make sure that that's in harmony with what's happening with other patient care data exchanges, other HIEs across the country. So we had planned to develop a working group that would help with both of those two pieces. And so we will do that work this summer, get those groups back together. There's clearly been some important decisions that were made at the ONC level that will help us. We're pretty much committed to having the tools associated with 3.5 be FHIR version 4 implementations. Whether those are document implementations or messaging implementations, we'll be able to talk about that over the summer. We do have working groups who have been meeting on this topic for several years on a on-off basis. We'll resurrect those groups. If you're interested in being part of this working group to help with that health information exchange questions, please just send me an email. We'd be happy to engage you. Josh is going to be helping me kind of lead these groups and formalize a process whereby we can develop the tools that will best meet your needs, what you're currently doing, but then also ensure that the data is coming in at the national level, and that all of the different exchanges, we're providing some standardized tools from our end that can help with those implementations. So that will also be on the agenda for the meeting. The last thing that we've been thinking a little bit about is perhaps having a section of the meeting being associated with any documentation, reporting, or kind of data flow practice changes that have been associated with the COVID outbreak, and determining if there are any implementations or changes that we need to talk about as an industry that would make, if there was to be a resurgence or if there will be other needs in the future, how can we be better prepared? So those are the three topics that we're planning to develop a little bit. I wanted to bring this to this group to see if there were any other topics that they wanted us to entertain during the annual meeting that will be a Zoom conference. Are there other topics related to 3.5 or related to 3.4 that you think would be valuable to discuss in this larger venue? Any thoughts at all? Are people feeling like those three topics would be valuable? CMMI coming and talking about ET3, providing an update on where we are with patient exchange and how that will happen, and then practice documentation and reporting changes associated with COVID.
No, they sound great topics. Yeah.
Okay, thanks, Adam. Yeah, appreciate it.
Yeah, sorry, I didn't have any real content to add. I was trying to think of something, but I mean, that sounds good.
Okay, good. If anything comes to mind, please just let us know. Feel free to email. There's an idea of adding virtual posters. We can talk about that, Arish. We've been working a little bit in regards to some uses of NEMSIS data. That could be a good idea. All right, fantastic. If you have any other ideas, feel free to email me or Julianne. We'd be happy to entertain those and put together that agenda. We'll certainly keep this group appraised of that agenda and the date for that meeting as it develops. All right, thanks, Julianne.
All right, sounds good. If you think of things over the next few weeks, next month or so, shoot us an email. We're happy to have those discussions so that the annual meeting is as valuable for everybody as it possibly can be. Next item is the June public training. That actually will occur next week, June 2nd. We're just going to do a quick training on using the EMS data cube for research queries, and specifically going over how to use elapsed times out of the cube. We've had a significant uptick in requests for understanding how to access and utilize the data. So we wanted to make sure we offered something available to everybody as well. We'll send out a flyer for that by tomorrow, so that if there's interest, or if you know of somebody who would be interested in learning a little bit more about how to utilize either the public cube, or if you have state access, you can also apply everything that we'll talk about to the state cubes as well. So that will be coming up. And then if there are any specific training topics that you'd like to see us address in the future, we're happy to take those suggestions, get them on the calendar, and do group trainings for things that may apply and be of interest to all of our different stakeholders. So next on the agenda is items from the Office of EMS. Go ahead and turn the time over to Eric. Do you need to share the screen, or Eric, or do you just want to talk?
I don't see him on, Julianne.
Clay, do you want to, I know there was a couple of topics. And he must have been pulled away for something. So
yeah, he must have been pulled away because we spoke this morning about it. And I'm really not going to go into detail here. I think Eric has some very specific details he wants to pass on to folks, and it's probably best heard from him. But there is real interest in, from FEMA and HHS for us to better develop a process whereby through NEMSIS, we can standardize an approach to evaluate the use and reuse of PPE. And how that would happen is going to be a sensitive topic that I think is best led by the Office of EMS. We clearly don't want to make massive changes to the standard, and clearly lots of the vendors are collecting this information now. I don't know how extensive that data collection is. When we look at the number of states that are utilizing the other elements related to PPE, it's only 11 states. And so perhaps not all states or even the majority are tracking this now. So how we would do that in the future, whether through a change in the national standard or some collaboration among vendors, is I think what he wants to talk about. So I'll just leave it at that.
Clay, this is Eric. Can you hear me now?
Oh yeah, Eric. Yeah, good.
Yeah, I'm sorry. I was on the telephone line and I must have been muted. Muted out of the meeting. Let me just give you a little background on that, and we could have discussed it during the COVID part of the conversation as well. So, up until now, historically, NEMSIS has been about patient care data, and at the national level, about clinical outcomes, clinical data. That was the focus. One of the things that COVID has changed, and there's been many, is that there is a very large interest now in more operational data at the national level. Not specifically from our office, but in terms of the FEMA task force and how they get and ask and basically delve out resources, for lack of a better term. So we'll use PPE, for example, because that's obviously the most prominent. And we worked with ESO and Image Trend and got their dashboard data access to Palantir, and we really appreciate that. Or their data available in PPE access to Palantir, which was very helpful. But what we hear from the states and what we hear from a lot of national NGOs and from agency level programs is they're not getting the PPE that they need. They don't have access to gloves or gowns. They don't have access to N95 masks or such. So the only way that we can think of to make sure that those voices are being heard is to have that come to a national level. What we're hearing in some states is that the process of requesting supplies and going through the Emergency Operations Center, whether it's through the Department of Health or whether it's through the Office of EMS, the system works very well. In others, it doesn't work at all. So with that, Dr. Kramer has asked that I speak to the vendors. We'll be talking with the state directors and the data managers as well. But I started with you folks just to give you a heads up to say, we are going to be looking at more operational data. We are going to be looking for ways to capture PPE needs and usage from the agency level direct to a national level. And I just put that bug in your ear to say that we're going to be coming back and asking for best practices and ways that you think this can be accomplished. And it is going to be a priority and it's going to move rather quickly. So I wanted to take that opportunity today to bring that up. I have expressed concern that in some ways we are circumventing the typical emergency management process. And it was pointed out to me that nothing about this response has been typical. So I'm moving forward as directed. I understand the need, and I think it's a great opportunity to show how NEMSIS can report something at a local level to a national level and see some sort of immediate and direct result. In this case, entering the supply chain, making sure that your voice is in the supply chain, your orders in the supply chain. I know that there are several states that have banded together to form buying consortiums, specifically for PPE and other supplies, medications, for example. Within the federal government, there are federal agencies that are doing that. So more to come on that, but I wanted to give you a heads up. specifically on things like PPE, but also to say, and this is in line with Clay's ask to NEMSIS, the resolution for this year, to look more at operational data and to look more closely at local data and not just specifically the national data elements. I'll pause there and be happy to field any questions, comments, or concerns.
Eric, this is Kevin. We have one question that's come in from chat from Steve at Code Red. He wants to know, will states standardize PPE? For example, I believe Oklahoma has designated E-Other 03 as a yes/no rather than specific PPE.
It would be my hope that that happens. I know that vendors have standardized across states. States will always have the opportunity to do something a little different. However, even to the point of opting in and opting out of participation in this. However, this is the only way that we know at a national level to be responsive and say, yes, the agency in the middle of Nebraska that needed PPE, that whose voice wasn't being, and I'm just using Nebraska as an example, that their voice wasn't heard, and we'll try to support them by working through their FEMA region, their state, to make sure they get what they need. So the answer to the question is, we hope to standardize it whenever possible. I want to standardize things. I know that we added, Clay, help me out here. Was it face shield and gown to the PPE list because it wasn't there on the national list at the beginning of COVID? There were two.
Right. So we added those custom values. That's correct.
So yes, it's my hope to standardize it.
Hello, Eric and Clay. This is Juan with Florida. A lot of this PPE information looks like it's more suited to a demographic part of the data set and capturing what, their inventory and what they have. And then the event information would capture what they use in the events.
Yeah, so Juan, your comments are a good one. Are you asking a question related to it, or just pointing that out, that's?
Just pointing that out, maybe as we look at it, trying to implement some of that stuff in the demographic data set to capture what PPE they have on hand when they get shipments, and then in the events would capture when they use them. So this way we can kind of see what's coming in and what's going out.
Oh, got it. So either section for what's going out, and then doing something with the demographic.
Well, that's an excellent idea. And I will tell you that the request is to know what is being used and what is being needed. It has not been to track what is in existing inventory. That doesn't mean that wouldn't be something of interest. It just, that was not one of the two specific elements requested. Okay, two other quick things. One is, and Clay, I apologize if they're on the agenda. I'm just scanning down here. The two advisory committees that we've discussed in the past, I have to take full responsibility for the fact that they have not yet met. It was our plan to have already met them. We've talked about them in the past. One is an internal advisory committee looking at data standardization, what should be in, what should be out. Are there better and best practices for collecting data so providers do not have to see 100 different elements to go through and get what they need for the typical call, much like what was expressed and discussed earlier when we were talking about medications. The second one is this external committee with folks from the Office of National Coordinator, looking at sort of the big picture. How can NEMSIS benefit from cloud services, so on and so forth. We are doing everything we can to get those two groups together. I'm hoping in June they will meet for the first time, and we'll have some more information to bring to you. The last thing I wanted to mention was NHTSA sought end of year funding to fund this e-outcomes, this exchange from hospital to pre-hospital data set. So, or not data set, but data standard. So you're going to hear more about that as well. We know that some of you have a big step on that already. So we'll be reaching out to you to, again, identify your best practices and where possible, not reinvent the wheel. But that was something that was asked for out of the January 29th Data Summit. And that seems like 100 years ago now, at least to me. But out of that, it was loud and clear that, okay, everybody would like to get this outcomes data back from the hospital. What is it that you want back? What is it we should be asking for? And then we heard from some of the hospital vendors to say, look, if you can give us some specifics, that will help. And then following up with Page, Wolfberg, and Worth to make sure that we have the proper documentation so that we can show any hospital that stands up and says, hey, look, EMS is not part of the healthcare system. They don't need this data back. It's a violation of HIPAA, blah, blah, blah. We can provide them with documentation to say, look, here's at least one legal opinion from a reputable law firm that represents EMS and hospitals across the country. And here's what they have to say on that particular topic. I will tell you that in the COVID response, I have seen one documented case where a hospital would not release the fact that a patient was COVID that an EMS service brought into the hospital. And their statement was, the EMS providers are not part of the healthcare team. It's that ridiculous. And we took that on and acknowledged that that was ridiculous. And that's why we're moving forward with some of the initiatives that we are. So more to come on that as well. With that, I'll be happy to answer any questions from NHTSA's Office of EMS related to NEMSIS or anything else. I can't tell you for all the work that you guys have been doing, the extra time providing states with what they need in terms of services and the fast pace that the questions have been asked. I'm so appreciative, you can't even imagine. So with that, questions or comments from me?
Hi, this is just Tim in New Jersey. Just have that one comment just to kind of echo a couple points that you had made. One, again, with the elements, I can't agree more with the overabundance of elements and having providers to have to search through them ends up having literally almost a sterile response to them in the sense that they just will literally pick one element that they think will work and then they stick with it, or they just pick the not applicable or not reported, and then of course that's nothing, and you end up with garbage on the other end. So I think that's a critical and definitely a priority that should be put on the priority list. Obviously, the second point is here in New Jersey. Unfortunately, we've experienced that several times as far as the COVID response and hospital dispositions and agencies. Literally just dealt with a county yesterday, actually 2 days ago, regarding that exact thing where the hospital refuses to give them the information, saying that it's a HIPAA violation. So they end up having to take their crew out for 14 days isolation because they don't know if the patient was actually positive or not. So these are definitely issues and concerns that are real life and happening every day. And I think definitely should be on the top of the agenda.
Thank you, Tim. That's all I have, Julianne.
All right. Thank you, Eric. Let's go ahead and move to open forum. If there are any questions or concerns, questions from previous topics that we've discussed today or unrelated topics, we're happy to hear those now. You're welcome to use the chat feature or unmute your microphone. And you've got a great audience for that discussion. So if there's anything you'd like to bring forward, now's a good time to do it.
Julianne, I just want to bring up the rolling up of the custom elements that we've recently released into the 3.5 standard sooner than later, if it's going to happen.
Clay, I'm going to let you take that one for the custom elements, rolling them into the standard.
Yeah, great question, Keenan. I imagine that part of that discussion will be associated with some of the things that Eric was sharing. Yeah, I'm just not sure yet. You ask a great question, and we've discussed this briefly again. There hasn't been further discussion at the Office of EMS about whether or not there will be changes to 3.4 or 3.5. It's a great question, and we probably need to start thinking about that, Eric. If there's some approach we want to take, or right now there's no effort to do that. They're left as custom elements, and I'm not sure that status will change. So sorry, Keenan. I wish I could be more.
And I think for the vendors, it's fine if it doesn't change. But what we don't want is to be on this call March of next year saying, "Oh, guess what? We're going to roll it in," right?
Yep. All right, thanks, Keenan.
Are there any other questions, comments, concerns? Okay. Thank you all for your participation today. We appreciate you taking time out of your busy schedules, especially with how crazy things have been. We appreciate you taking time to have these conversations with us. Our next V3 implementation call will be June 10th and then June 24th. As always, we keep them on the 2nd and 4th Wednesdays of the month, and send you out those calendar invites. Any questions, concerns, issues, anything you'd like us to address for the annual meeting or for a future call, please feel free to email or call us, and we're happy to have those discussions. Thank you all for being here with us this morning, and have a great day. Thanks.